Hi everybody, today we'll be talking about reconstruction after a lumpectomy. There's two big categories of reconstruction. That's reconstruction after a mastectomy, which is removal of the entire breast gland, but leaving the skin, and reconstruction after a lumpectomy, which is taking a piece of tissue with the cancer out and some healthy tissue around it, which is called the margin. This leaves your breast mostly whole, but missing a defect or there's a space in it. The way we reconstruct these defects is called an oncoplastic approach, and that means using local tissues in your natural breast next to the defect to fill the space. The scar ends up looking like a breast lift or a breast reduction scar. You may have heard of Wise pattern or inverted T or anchor scar. That's an incision or scar around the nipple, down the middle, and across the bottom. This allows us to do the operation at the same time as your breast surgeon once they've completed their procedure. We open the breast up and take some of the droopy tissue and excess skin, and after doing some maneuvers, we rotate it into position to fill the defect. So that way your breast is whole again. This is one of my favorite operations because it almost leaves you with a nicer, rounder, prettier breast than when we started. It's also nice because it's paired with a breast lift on the other side or a breast reduction, and those are called symmetry procedures. If we need to make your other breast, the one without cancer, smaller, we'll reduce it or lift it to match. That's called the symmetry procedure and is done in the same day. Again, one of my favorite operations that you're able to go home the same day, have a nice looking breast, and have your reconstruction done in one step. There are times when we add some adjuvant therapies to this, adjuvant surgeries or revisions, and that's after you've healed and had any radiation or chemotherapy that may be needed. These are fat transfers that help soften the edges, and perhaps even an implant if the defect was larger than expected. And we'll talk about more of those at your consultation.